February is Gum Disease Awareness Month, and joining us this morning to tell us about the national and global efforts that are being done to raise awareness of gum disease is Dr. Robert Gregg with the Institute for Advanced Laser Dentistry. Good morning, doctor. Glad to have you here.
Good morning. Happy to be with you.
So let's talk about gum disease, because I still think this is something, I feel like we are talking about it a lot, but yet I still think there's a lot of misconceptions about what it is and how dangerous it is. Can you touch on that a little bit, doctor?
Yeah, we know that 85% of the population, believe it or not, has some form of active bacteria in their mouth. Like we could call it gum disease, if you like, or maybe some of it's gingivitis. But in any event, 85% of Americans have something. Over 100 million have moderate to severe, and have gum disease, and 50% have moderate to severe, and only 3% are being treated. So. And 40% of those who have moderate to severe don't know they have gum disease. So there's a fear of it. It's almost a social thing not to talk about it. But if we're going to talk about pretty smiles and beautiful teeth and bleaching and cosmetic dentistry, we have to talk about the foundation, because we really don't want our houses to sink in a foundation that's unstable. So we need to shore up the foundation before we can do those beautiful cosmetic procedures and bleaching of teeth. And it does have consequences for the rest of the body. We know it affects heart, strokes, preterm babies, low birth weight babies. Even some cancers have some increased risks associated with gum disease. So it really touches all of the major diseases that we deal with, diabetes. And if you have gum disease, you're anywhere between 2 to 4 times, sometimes even higher risk to having complications or even exacerbations of, say, those systemic diseases like cancer, like diabetes. So it does have a global impact on our bodies, if you will. And Gum Disease Awareness Month is something that the Institute for Advanced Laser Dentistry developed as an initiative that has been adopted by all 50 states, the U.S. Virgin Islands, Guam, as part of the LANAP protocol treatment that we offer for treating gum disease. But also just get to your dentist, have a checkup, ask them to measure your gum tissue, make sure that you don't have any active disease, because it can be intercepted early before more expensive treatments are needed.
Well, and that's what I was just going to ask as we kind of wrap up here. What is the main message? Just go to your dentist, make sure you're asking, and specifically to ask about gum disease while you're sitting in that chair?
Yeah, say, would you please measure my pockets and make sure that we're not getting into troubled waters? A lot of dentists don't always do that, and the hygienists maybe don't do that. Find a dentist that will measure the pockets and tell you where you stand. Often the signs and symptoms of gum disease don't show up until disease is very advanced. So let's not wait that long, because it can be intercepted much earlier with no pain or little invasiveness and much less expense. So yes, see your doctor, see your dentist, hygienist, ask them to measure your gum tissue. That's the biggest message for Gum Disease Awareness Month.
All right, doctor, where can you send us if we need more info this morning?
Yes, 1-887 LANAP, the number 4, and YOU.
All righty. Well, thank you so much, doctor. We appreciate your time this morning.
Thank you so much.